Hello, everybody, and welcome to Wellness Today. I'm your host, Tracey Gonzalez. I'm a licensed clinical social worker in the greater Danbury area, and I am so excited about today's show. You are going to learn so much. We are going to have a lively discussion with my guest today, and her name is Erica Wilcox. She is a certified EMDR practitioner. She's also certified in perinatal mental health, but today our focus is going to be on EMDR therapy, and I'm going to allow Erica to explain to you exactly what that is. Welcome, Erica.
Hi,
welcome to the
thanks
show.
for having me.
It's my pleasure to have you today. We've talked before the show started taping, and we've had lively discussions already, so
Right.
I think that we're all going to glean a lot of really good information from you today.
Right.
So why don't you just go ahead and jump right in. What is
Sure.
EMDR? Say hi to the
Absolutely.
view, whatever, just go ahead.
Happy to.
Yeah.
So EMDR it stands for eye movement, desensitization, and reprocessing.
Mouthful.
And it absolutely is a mouthful, and it sounds intimidating and it sounds very complex, but I'm going to break it down for you in simple terms today.
Okay.
And what EMDR is essentially is a highly researched, highly effective comprehensive form of psychotherapy that identifies and targets stressful experiences, traumatic life experiences, a whole host of things that may have a negative impact on somebody's life, and works with the brain and the body's natural ability to move towards wellness and to heal itself in order to have those disturbing experiences be less disturbing so they can get back to their lives and living full, meaningful lives.
Oh wow, that sounds great. You know, it sounds great because a lot of times people come to therapy and they have been through some really intense situations, or they're highly anxious, or they are very depressed, and they want something done right away.
Right, exactly.
Something quick, something done very quickly.
Right.
And the way that you describe this, I know that things don't happen in a second, but it sounds like this may be something that people would be interested in. So could you tell us a little bit more?
Sure, exactly. And so EMDR originally began in 1989 with the developer Francine Shapiro, who was taking a walk and was thinking of things that were disturbing her. She had some stuff going on in her life at that time. And what she noticed is that her eyes started to move back and forth when she was thinking of something disturbing. And when she started deliberately moving her eyes back and forth, she noticed that that disturbing material lost its charge and became essentially less disturbing. So it was really born out of that. And the eye movement part is what most people are really most curious about, and I'll tell you more detail about that.
Okay.
But it really starts from the premise that, like I had mentioned before, you know, what is EMDR, why it's important, is that our mind and our bodies are geared towards wellness. If you sustain an injury, a cut, for example, on your hand, your body is going to work automatically to start repairing that injury.
Right.
If there is a block, a splinter, for example, in that cut, that injury is not going to be able to heal properly.
Okay.
So the brain is part of the body.
Yeah.
And if the body moves towards wellness, the mind moves towards wellness as well. So EMDR taps into that natural ability to move towards wellness and identify the stuck points, the memories, the experiences that somebody may have had that are essentially like splinters in the mind.
Okay.
And so we identify those and use eye movements to get them unstuck.
Wow.
So you're retraining your brain, literally.
Yes. And let me ask you something. And you know, I was going to ask, why is EMDR important?
Right.
And you just said a lot. You answered my question before I even asked it in a nutshell. But there are people that say to me, this sounds interesting, but it sounds very new agey. I don't know, I'm scared. I don't know if I want that. It sounds like, you know, hypnosis or something. What would you say to that, you know, before you go on?
Absolutely. So, and I'll share my own personal experience. So I was working in the field at an agency and worked with a lot of individuals who were struggling with depression, anxiety, trauma, phobias, all things that EMDR can treat, by the way.
Nice.
And I noticed that they weren't getting better as quickly as I wanted them to, or as quickly as they wanted to.
Okay.
So I heard about this EMDR. People are starting to talk about it, and it's relatively new, but it's getting a lot more media coverage now and becoming a lot more well known, which is terrific.
Right.
So when I first went to the training and I started to learn about this, I thought, what did I get myself into? What did I invest my time in and my money in? And this seems kind of bizarre. And then once I experienced it myself, because as a trained EMDR practitioner, you go through EMDR yourself.
Okay,
You
that
wouldn't want to
makes
go to a
sense.
physician that doesn't go to their own doctor
Exactly.
for checkups, right?
Yep,
So,
exactly.
And it wasn't until I experienced it that I thought, this is something. This accelerates the healing process on a physiological level. Other forms of therapy, if you think of like a weed, right? You have the top of the weed and then you have the roots.
Right.
You can talk about things that are bothering you, and that's like just kind of snapping off the top of the weed. And what
Right.
happens when you do that?
Right. Just
It grows
keeps
back,
growing.
right?
Yep.
So EMDR gets to the root of the issue to be able to identify what's at the core of issues today.
Okay.
And people get better a lot more quickly. There's over 100,000 trained EMDR practitioners over 52 countries
Wow.
now. So it's widely expanding and the research is ongoing.
Okay, so it's even international.
Absolutely, yes.
Oh, okay.
Yep.
You know, I never really thought about that, but I guess so, huh?
Right, so people are using it for the rapid treatment of traumatic events such as 9/11 or these mass school shootings. A lot of big traumas that are happening, EMDR can be effective for, but also it's useful for what we call little T or little traumas. You have big T's, the big stuff we hear about that hits the news,
Okay.
and you have little T's. So that may be being bullied as a child. Well, for somebody that may be a big T as
Yes.
well. You know, moving, the end of a relationship, all things that may be disturbing someone. The big part of it is that and this is where the eye movements come in,
Okay.
right? So when you sleep and you go into that deep state of sleep, we have what's called rapid eye movement, REM sleep.
Yes.
And what's happening during that is your eyes are rapidly moving back and forth. And REM sleep is like the digestive system for the brain. So if we think of the digestive system, we incorporate what nourishes us, what we can use, and we discard the rest.
Right.
So when you're sleeping, our brain consolidates, makes sense out of all the things that have happened. We keep what we can use, we discard the rest. When you experience something stressful or traumatic or disturbing, that is like a piece of gum in the digestive system. It can get stuck. It can't fully process. So what EMDR does is simulates the same type of eye movements in REM sleep. And very simply, that's somebody following my fingers through their field of vision with their eyes. And what that does is simulates both sides of the brain to allow that sticky gum to get
Unstuck
moving.
and
So I often tell my clients, if you think gum, it gets unprocessed memories moving, GUM.
Very good. Excellent.
So, and so when we experience something stressful, our brain can get hijacked. And what happens is it gets stuck in the right part of the brain.
Okay.
And that is where our emotions are. That's where we feel things. You know, say like, I just have a gut feeling, or you can experience something on a visceral level, but you don't have the words to say it. I think we've all been there. EMDR works to capture those memories and negative beliefs that are stuck in the right hemisphere and move it over using bilateral stimulation. So that can be eye movements, and there's some other ways to do that as well. I use the eye movements.
Okay.
And moves it to the left side of the brain where language is, where we can organize, where it's less, where the past is no longer present.
Yes, yes. You know, and I don't want to get real deep here, but you know, as you're talking, I'm thinking about how medication works. And as you're explaining, you know, moving these thoughts from one part of the brain to another, you know, being desensitized to different memories and whatnot. I'm thinking about how medication can kind of like do the same type thing, but you don't have to take medication when you're doing the EMDR. You know, I'm talking about when you're sitting in your office. You know, it's just such a comparison. You're like stirring up a lot of thoughts in my mind right now.
And I say to my clients, and so EMDR is a highly effective way to treat anxiety, depression, trauma, phobias. It's expanded to the treatment of eating disorders, addiction, a whole host of issues, but it's medication free. So the pill, I always say the pill is not the skill. So the pill can kind of take the edge off, but you're not really getting to the root issues of things. So that EMDR, the eye movement part, so it's stimulating both sides of the brain. So you can do eye movements. Some other therapists, practitioners use what they're called TheraTappers. And it's like two little pods you hold in your hand, and they alternate vibrating. So again, you're stimulating both sides of the brain, bilateral stimulation. Other people may use auditory bilateral stimulation. So they wear a set of headphones, and there's click on each side, click, 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 click. And some other therapists may use what they call a light bar. So it's a bar, and it has little dots of lights that you just follow in your field of vision. So there's a lot of ways to...
For the eye movement piece.
So the eye movement part is really a kind of a small portion of that. So it's a very comprehensive type of treatment. I don't recommend people try to do this at home on their own.
No, that's important to say.
Yeah.
Why not? Why?
Because you can you can re-traumatize yourself. So this is EMDR therapists go through extensive training after their usual course of training to be a therapist and obtain their license. And as an EMDR therapist, if you were my client, I'm following the set of protocols, but I'm also watching you very closely and assessing to make sure that you are not being re-traumatized and that you're within a window of tolerance so that you have enough emotional charge to access those disturbing events, but not so much that I'm going to have to peel you off the ceiling.
I see.
So that eye movement part is that. And the desensitization doesn't mean, and this is what's really appealing to a lot of people, you don't have to talk about the trauma in a lot of detail. So if you want to, that's okay. But trauma is stored in our bodies as well. And so with EMDR, we work on healing on a physiological level. We're working with the sensations. We're working with the visions, kind of the mental picture in your mind of whatever's disturbing you. The thoughts that go with it, and we're all kind of gathering that up and working to desensitize that with sets of the bilateral stimulation.
So basically, when you said that trauma is stored in the body, if someone is 20 years old and a traumatic event happened when they were 12, let's just say, that trauma, that the impact of that trauma is in there somewhere. You're saying
it can be.
It's in there.
Not for everybody. So when we think of trauma, you know, it's about what people have experienced, but really I like to think more about how it's impacting you in the present. So you can have person A and person B, and person A is in a terrible car accident, person B is in a terrible car accident. Maybe there are different protective factors, supports in place, coping skills for person A, that car accident when they were 12 doesn't impact them when they're 20. That their mind was able to process that fully, move it over to the left side, but perhaps for whatever reason, person B, all of those sensations, that experience of the car accident got frozen in their brain. It's stuck in trauma time.
Yes.
And that it may be maybe now, if they're driving on the highway, they become fearful.
Right.
This, indicative of what we would call post-traumatic stress disorder.
Yes.
So not everybody is impacted by the same way. It's really, we're getting a pulse on how it's impacting you in the present, so you can move forward in your life and move that material where it needs to go.
How about our veterans? Our veterans who are diagnosed with PTSD,
Right.
is this something that would help them if they were
Absolutely.
on board?
Absolutely. And it is, this EMDR is supported by the American Psychological Association, veterans, and is one of the 5 recommended treatments for post-traumatic stress disorder.
Okay.
When EMDR first came out, it was geared a lot towards veterans, and you can, if you Google it all, it will all come up, and seeing rapid results compared to other forms of psychotherapy. So not necessarily in one shot, one session, but we're talking about weeks or months of therapy as opposed to years, which is astounding.
Yeah.
So absolutely can help our veterans, for sure.
I was thinking about our veterans. I was thinking about what you said about how people want relief. They want help if they've been impacted by trauma. But one of the difficult parts is coming into an office with someone and talking about the experience.
Right.
Or going into your 3rd therapist's office in 5 years,
Yes, absolutely.
and having to talk about this experience over and over and over again. But it sounds like this really works. This is very beneficial to those who they're just besides themselves, and they really don't want to kind of like dredge up the past in such detail anymore. Ages, like what ages? Children too?
Children too. You do it a little bit a different way.
Okay.
The children I've worked with, I draw little smiley faces, and sometimes you do it that way, and then you get creative with ways. But so it's excellent for trauma. But it's great for things that people know that are there. So somebody has post-traumatic stress disorder. They were deployed. If somebody experienced, like we said, a car accident or something like that, and maybe they're reliving it and they have PTSD, and we know clearly what the connection is. But also, and I've seen this in my work, and the research supports it as well, it's great for the things that aren't so much in somebody's awareness. So for example, I started this new job and I'm really having a hard time with my new boss. I find that it's hard for me to speak up. I don't know what's going on. I get anxious. I get this butterflies in my stomach every time I see him or her. And through EMDR, we connect the dots and do some memory work to identify what is the root of that.
I see. Maybe
they had an experience of being humiliated by a teacher when they were younger, an authority figure.
Right.
And so now authority figures, a boss, and adulthood, those same things are being stirred up for them.
Okay, so you have that scenario.
Absolutely.
And let's just say that a client comes into your office and they're not coming to see you for EMDR. They're coming to you because you are a therapist, you know.
Right.
And you're not even thinking EMDR because you have other modalities that you use too, okay? And that person comes in, and what is it inside of you that kind of clicks and says,
Right.
I think I may want to talk to them a little bit about EMDR.
Right.
What are you seeing?
Yeah,
What clicks?
So not everybody is appropriate for EMDR.
Okay.
And I will say that after, I'd shared that experience once when I went through the training and seeing it and going back to those same clients and starting to use these tools and seeing their lives change. So it's completely changed the trajectory of how I do therapy.
Yeah.
And so I do EMDR, I would say probably with 85% of the clients that I see. Some where it's really clear-cut trauma, others generalized anxiety issues like I explained. So if somebody's coming in, what makes a good client an EMDR or EMDR eligible is one, that they're able to have dual awareness.
Okay.
So
what does that mean?
Right.
Yeah.
So and some of these terminologies they have to make it difficult for people. Right? So dual awareness means that I'm able to have one foot in the past, working through those memories, but also one foot firmly planted in the present, knowing that this is not happening to me now, that when we're doing the desensitization, that I'm safe, I'm okay now. So before I even start reprocessing with the client, we take some time to get a thorough history, understand what's happening, like, of course, what brings them in, but also build a sense of trust and safety in the therapeutic relationship. And I want to make sure that my clients really have the tools necessary to cope with any intense emotion that may come up. So that's one criteria for being a good candidate for EMDR, is that you're able to have that dual awareness and be able to cope with some intense emotions. Because with EMDR, it peaks, and the intensity peaks when you're reprocessing, but then it dips off a lot more quickly. So by the end of a session, even if the person's leaving feeling really positive, their brain has done a lot of work, and they're usually quite tired. So, yeah.
Wow. So are you seeing your clients like once a week? Like how long are the sessions and how often?
Right. So initially, and that's really, it's determined between the client and I what works for them, and I'll share my preliminary recommendations. At the very least once a week. And so in the beginning, I would say it's probably about 2 or 3 sessions, getting a thorough history, establishing what their strengths are. A lot of people come into therapy saying, here, I very clearly knowing what their the problems are, but I take a very strength-based, positive psychology approach, and we want to know what we have to work with that can help carry you through, and we want to capitalize off your strengths. So a few sessions for that, and then meeting weekly, sometimes twice a week, for 60 to 90 minutes. I've recently started doing some EMDR, what I call EMDR intensives, where I meet with somebody for 3 hours at a time, which is a lot of work for the client. And I'm so humbled and astounded by the willingness of my clients to show up and dig deep and do the work. And in the 3-hour sessions, what I'm noticing is people, it's like doing a month of therapy in one shot.
Yeah, that's really amazing.
Yeah.
That's amazing. And you talked about making sure that clients have tools, the tools that they need. What are some of those tools? Are you talking about coping skills? Are you talking about family members? Like what are some of the tools?
Right, so some of the tools, making sure that there's a positive support network in place. So if somebody is living in an unsafe environment, if they have a lot of tremendous amount of stressors, or if they're currently in an abusive relationship, for example, not the best time to do EMDR. We have to put out the fires before we rewire the house. So that's one part, but also working on some ways to learn how to regulate emotions. So becoming more aware of if I start to get anxious or start to become triggered in a way, what are some specific things that I can do to center myself, to calm my body? It's a great, I share this with my clients, and it's like, I don't know if it's that much top secret, but one of the biggest anxiety hacks is that if you can calm your body, you can calm your mind. It's impossible for your mind to be running if your body is calm. So, you know, when you say like, oh, just think of something different, it's like, don't think of a pink elephant. Well, what are you thinking about now?
Yeah, exactly. So that pink elephant is right there.
So calming your body. So making sure they have supports, making sure they have the tools, and knowing that, I just realized that I answered this question, that the client is always in control. So this is not hypnosis in the sense that that the client, their mind is always in control. They can stop at any time, and that it's always going to lead them where they need to go. So the memories may shift, but it won't take away anything that you need.
Okay, that's great. That's great. That's, you know, I'm trying to ask questions that I know that others have had. I spoke to a therapist. This was a couple months ago. He was telling me that he was working with a client that was very depressed, very, very depressed. Nothing was working, and he is a certified EMDR therapist.
Wonderful.
But, you know, he wasn't doing the EMDR. He was, you know, it was more or less talk therapy, maybe some CBT.
Right.
And so one day he talked about EMDR to his client. The client agreed. They started the process. He said the very first session, there was a change just like that. Right away.
Absolutely.
He was able to notice.
Right.
Yeah, it's just amazing. I'm so glad that you're here because, you know, I have questions. I have questions myself, so you're answering a lot of my questions. Real quick before we have to stop, I just want to ask you very quick about the reprocessing.
Right.
And you might not be able to go into it deeply right now. To our viewers, Erica will be back, so we're going to go a little bit deeper. But that reprocessing piece, really quick, could you just give a quick intro on what that looks like, that piece there?
Right. So like I explained before, when we can have memories or beliefs or experiences that are dysfunctionally or trapped on the right side of our brain. It's some survival stuff, their survival skills are in there.
Right.
And so when you reprocess, we're identifying those stuck points and we're allowing to move them over to the left side of the brain so that it neutralizes the impact that it has in the present moment. So someone can say, this happened, it happened to me, but I'm okay today and I survived.
Okay, and all the while you're doing the eye movements.
Right.
I see.
Right.
Very, very interesting.
Right.
Thank you.
Thank you
so
very
much. I'm just going to stop right there because I want to make sure that I don't want to go into something else because I'll sit here and ask you a million questions. So we're going to stop right there. We just want to thank our guest Erica for coming on today. Certified EMDR Therapist. Part 2 is coming up next time. Thank you very much, Erica. And please join us. And remember, do all you can to experience wellness today. Take care. See you next time.